I'm a student physical
Hi, nice
therapist.
to meet you.
Nice to meet you. So your doctor sent you in for Achilles tendonitis?
Yep. I actually had an injury. Well, I thought it was an injury probably about a month and a half ago, and so I finally went to see him because I was struggling going up the stairs. And he just told me that I needed to come see you.
Okay. So you were struggling up the stairs. Was it painful going up the stairs? Or?
More irritating than anything.
Okay.
I'd say the pain, it's like moderate, nothing I can't handle.
Okay. Is that only when you move, or is it kind of constant?
No, it aches when I'm sitting here, but it's not like shooting pain or anything.
Okay. So right here, right now, on a pain scale of 0 to 10, 0 being no pain, 10 being the worst pain you can imagine, what would you rate it right now?
Probably like a 2.
Okay. 2. Is it okay if I check it out?
Absolutely. Do you need me to take my shoe off?
Yeah. Okay. Now is it tender when I touch here?
Yeah, definitely.
Okay. When I move it, does that pain increase?
Yeah,
How much?
probably like 2 or 3.
2 or 3? Okay. And then can I have you take off your other shoe, please? I'm just going to kind of compare the two. Yeah, this one has a lot more motion. What I'm going to do, because it looks like you got a little bit of swelling going on, I'm going to take a measurement around your ankle just to kind of compare the two. Yep, looks like that one's a little more inflamed, about 3 centimeters. And so you said this one's about a 3. All right, I think what I would like to try and do today with you is something called ultrasound.
Okay.
Okay, so you were having pain and a little bit of tendonitis going on, so I want to use ultrasound because that's a typical modality that we use for pain and tendonitis as well, or tendon injuries. Other issues that we could use it for is if you had like a surgery scar and was trying to stretch it out, you could use it for that. If you had a wound, any type of skin lesions or skin scarring like that. Bone fractures, it also helps with calcium reabsorption. It's been shown to help with plantar warts. But pain and the tendon injuries are the normal ones. So before we get started, I need to ask you a couple questions, just to make sure everything's safe. Are you pregnant or trying to become pregnant?
Absolutely not.
No? Okay. Cancer, does it run in your family?
My grandma had cancer, but besides that, the rest of my family has been perfectly healthy.
So do you have any like pains at night?
Nope.
Fevers at night, night
Nope.
sweats, anything like that?
100% healthy besides my
Okay, that's good.
meal.
Let's see. Have you had any joint replacements or joint cement, any type of plastic in your body, any type of metal pins or anything like
Yes,
that?
I have a huge metal plate in my knee and a bunch of screws and pins, but besides that, I have
Okay.
nothing
Well,
else.
we'll just keep the ultrasound away from that. It should be
Okay.
fine. It shouldn't affect it at all. Have you had any vascular issues, any type of blood clots or anything like that?
Nope.
Any irregular heart arrhythmias? Anything?
Nope.
Okay. And of course, we're going to be avoiding the eyes and any type of reproductive organs. Do you have a pacemaker?
No.
Okay. Will be on the back area, but it shouldn't be anywhere near any type of central nervous system
Okay.
type things. All right. Just a couple more questions. So you said the injury was about 3 weeks ago, 4 weeks ago?
Yeah, it was about a month and a half ago, so about 6 weeks ago.
Okay, so it's been a slowly progressing
Yeah.
type.
And finally, my mom just convinced me to go to the doctor.
Okay. All right. And I'll take a look at your x-rays that you had done just to make sure that your growth plates are fully grown and that you don't have any type of bone fractures or
Okay.
anything like that. Do you have any breast implants?
No.
All right. Started, I'm going to kind of feel around and make sure everything's okay here. You got, like I said, a little bit of swelling, but nothing feels out of the ordinary.
Okay.
Let's go ahead and get started. Explain what's going on. We have several different settings for ultrasound, and since I would consider your Achilles tendon a little more superficial, I put it on a kind of a higher intensity for frequency.
Okay.
We have this thing called duty cycle where pretty much it's the sound waves are kind of on and off, although that's not technically the best way to describe it, but that's how I'm going to tell you. So you shouldn't feel any heat with this, but that's not saying that you won't. But we have it on about 20% since this is a chronic injury.
Okay.
And tendon. That's normally what's recommended. We also have a lower setting, about a 0.5 of watts. That's kind of a conservative amount of intensity for your injury, but we can work up as we go along. And we're going to do this for about 8 minutes, okay?
Okay.
All right, let's go ahead and start. Ready, set, go. Okay, Callie, we're about halfway through. How are you feeling?
I'm feeling good.
Good. And your skin's looking fine. All right, we're all done. How do you feel?
I feel good.
Okay. Your ankle feels good. There's no redness or anything that looks abnormal. I'll go ahead and measure your ankles again. All right, the swelling didn't go down, which is pretty normal. We're not expecting anything. It's not a magic treatment. How's the pain?
I feel better.
A little better?
Yeah.
Out of a pain scale of 0 to 10, how would you feel?
Probably about a 1.
About a 1?
Mhm.
Okay, so your pain went down some. Normally for this treatment, we do about 4 to 6 sessions
Okay.
before we decide if we're going to stick with it or get rid of it. If at that point we don't feel like anything's getting any better, we'll go ahead and not do the treatment anymore. But if you feel like you're getting a good effect out of it, we'll keep it going.
Okay. Sounds good. Thank you.